Hey guys, welcome back to our channel Medphonics Talks. My name is Mohammed Unis. I am second year medical student from Fergana Medical Institute of Public Health. Today we have some questions regarding our bones. We have already discussed about the bones, right? We have already completed the general anatomy and we have completed the question bank. Now we are going to start the question bank for the bones. There are only 10 or 9 questions are here. These are very basic questions. This is not included in your NEET PG or something like that, but still you have to have your own practice on your own, right? You have to examine yourself that whether you are studying or not. So let's go with the first question. It's given that which among the following are included in axial skeleton? Included in axial skeleton. Which among the following are included in axial skeleton? You know that axial skeleton is 80, right? And appendicular skeleton is 126. So, which among the following are axial skeleton? You know that pectoral girdle, phalanges, auditory ossicles, tarsals. Pectoral girdle, whether it is axial skeleton or appendicular skeleton. I have told that pectoral girdle form the shoulder joints, right? These are extremities. So, it is not the answer. Then, phalanges. Phalanges is also belongs to the extremity. It is also not the answer. Next one, auditory ossicles. Then the tarsals. Tarsals forms to the lower limb and it is also not the answer. Then the answer should be C, auditory ossicles. Auditory ossicles, which is in the axial skeleton, which is inside the ear, which forms the malleus, incus, stapes. These three forms the auditory ossicles or ear ossicles. Next question, rickets caused by. Let's see, this question is so I have taught in your clinical anatomy section of your bones video. There is vitamin A, B, C, D deficiency. Rickettsia is caused by the vitamin D deficiency. I have told in the class about this question. Next one, scurvy is caused by. You know that rickettsia is caused by vitamin D deficiency. So it will be not the answer. A, B, C. C is the answer. Scurvy is caused by vitamin C deficiency. Vitamin D deficiency causing rickets and vitamin C deficiency causing scurvy. Next question. Bone marrow puncture. Don't worry. Puncture means biopsy. Don't worry. Biopsy. Okay. Or aspiration. Bone marrow biopsy or bone marrow puncture is done in dash in children and dash in adult. I haven't thought about this, but I have only told about what is bone marrow aspiration, right? Bone marrow aspiration is mostly done in thickest bones in our body. Which among the in our following body there is a thickest one, and we can't risk, right? If I have to going to puncture the bone, there will be hollow space there. I can't risk among that, so I am going to take from a thickest part of our body. You know that hip joint is having ilium, ischium and pubis, right? Suppose this is a hip joint and this is a sacrum. Okay, hip joint. I'm having this is a ilium. This blue part is ilium, and this ilium have iliac crust or iliac crust. From here, I will take the biopsy from the children. Then I have told that we are having dagger shaped bone, right? What is it? Which is a dagger shaped bone in our body? Sternum, right? In our sternum, I'm having dagger shaped, right? I have told that it is a dagger shaped. In dagger shaped part, there is manubrium, and this is some of the notches which will connect the sternum ribs. Then clavicle, then some of the ribs here, so on, and this is a xiphoid process, suppose. And in adult, we will take the biopsy from the manubrium. Don't worry, let's go to the options now. A, manubrium sterni, iliac crest. B, xiphoid process, iliac fossa. Iliac crest, manubrium sterni, iliac fossa, xiphoid process. I have told in the children we will take the from iliac crest, and in the adult we will take from the manubrium sternum. Then the option will be C, iliac crest and manubrium sterni. This manubrium, you already know that. Sterni means, what is that? Sterni, we have told sternum, right? This is Latin called sterni. Okay, then we are moving on to the next two questions. Next question is, what percentage of calcium of the bone is stored in the bones? I have already told about that, 97, and I have told that always remember the calcium in our, not only calcium, phosphorus also. 97% of our bone is formed by the calcium and the phosphorus. Then first bone to start ossify. I never thought about this. I will teach you now. Ossify, I am explaining again. Ossify means the formation of bone. Formation of bone. So this bone is formed, right? So in our body, which is the first bone will be forming? Always remember clavicle. Clavicle is the first bone. It is the only bone which we can see superficial. Which if you are seeing my other part of our body, you can't see the bones clearly. But if you are taking my clavicle, you can see the clavicle clearly here superficially. Okay. Then the clavicle is the only horizontal bone, long bone in our body. There are many properties in clavicle. We will talk about that more later. Then the next question is, which of the following ossifies in the membrane, right? Question is ossifies in the membrane. So that means that they are membranous bones, which is under the classification of the developmental classification, right? Humerus, clavicle, femur, radius. Clavicle is a bone which ossifies in the membrane. Okay, always remember there are so many properties in clavicle. We will talk about that, but always remember it is the first bone to ossify and it is a membranous bone. Then next one is the skeletal system is made of. It's very simple question, right? Bones and tendons, no. Bones and cartilage, yes. Vitreous humor, no. Vitreous humor is inside the eye. Minerals and fat, no. So the answer is bones and cartilage. The skeletal system is formed or made up of bones and cartilage. Then next question, sesamoid bones are found embedded in. What is sesamoid bone? Have told, right? The skin and under there will be tendons, and the skin and tendons will cause a friction to the bone, and this friction will cause the tendon to harden themselves, and this forms the sesamoid bones. So in here you can see it will be tendon, and this is also tendon, and to the rupture of here, friction of here, it will form like a bone here, and this is sesamoid bone. Sesamoid bone. Then what structure is this one? I have told tendon, right? So joints, no. Muscles, no. Ligament, no. Then that is tendon. Tendons are found embedded in the sesamoid. Embedded means inside. So inside the tendons you can see the sesamoid bones. Next question. Most of the bones of the arms and hands are long bones. We know that, right? If radius, ulna, humerus. Okay. Then, however, the bones in wrist are characterized as wrist, this part, carpals. Okay. Flat bones. There are flat bones? No. Flat bones. What are the examples for flat bones? Scapula. Then short bones. Is it short form? Short bones? Let's wait. Sesamoid bone. Is it formed by the friction? No. But one of them is formed by the friction, which is pisiform. Let it be there. We have 8 carpals. We can't consider one guy for that, right? We want to make sure that all are together, not only pisiform. Then irregular bone. They are irregular in shape. Yes, it is irregular, but we can tell it is a short bone. It will be more suitable if we are telling these bones are the short bones, not the irregular one. Okay, so the answer will be short bones. Next question. Factors affecting growth. Okay, this is not a question. I have to explain you something about this matter. Factors affecting growth. What are the factors affecting growth? There are 2 factors affecting the growth. First one is vitamin, and next one is the hormone. Then you will tell that, oh, okay, then vitamins and hormones only are needed to form the bonds. No, I want protein, carbohydrates, minerals, fat, everything I want. But among all these, vitamins and hormones are more important. I want 2 major vitamins, vitamin A and D. Vitamin A and vitamin D. Which is causing rickets? Vitamin D. Which deficiency is causing scurvy? Vitamin C. Then that means that deficiency of D will leads to rickets. So I want to take D more, which means that what is rickets actually? Rickets are vitamin D deficiency, and this will cause a reduction in my size, which means that you can see the patient or the individual will be having bow like legs, bow like legs, or a C-shaped. Okay, this condition is known as rickets. Okay, this is caused due to the vitamin D deficiency. Then vitamin A is very important because these bones will control all my activity and the coordination of the bone. Control control, activity, and coordination. Coordination. So vitamin A and D are more important. Then next about the hormone. What all hormones which is very important? Have you heard about the growth hormone, which is helps in the growth? This is the first hormone you should uh, study about this bone formation, growth hormone. The next one is parathormone. Parathormone. Then third one is the calcitonin. Calcitonin. So these three hormones are so important for your growth of your bone. Growth hormone. Okay, growth hormone. Next one is parathormone. Parathormone is from parathyroid gland. Parathyroid gland. Okay. Next one. Calcitonin is from the thyroid gland. Calcitonin is from the thyroid gland. Then these are important vitamin and hormone. These are the factors affecting the growth. I hope you understand every questions we have discussed today, and I have taught you one more session about the factors affecting the growth. Then I hope you should be able to do more questions from this topic. Next video we will talk about the question discussion about the joints. Then after these sessions you should go through this video or textbooks again, because I haven't complete everything in one video, because I can't take all topics in one video, because there is limitation of time, and you should also not get to bore about this anatomy always. But you should study this subject because it's very important, and this is the foundation of medicine. Without anatomy you can't focus on your physiology, because in physiology you will study the functions of everything. Now I told about the growth hormones, right? This how this growth hormone formed and how this will applicable on the bone formation, everything you will study in the physiology. So without anatomy you can't study physiology. Without physiology you can't focus on internal medicine, pathology, everything. So I hope you have understand today's session. We will study more about joints and all, and question discussion upcoming days. So I hope you have understand, and I hope you will share this video to your friends, because they can also study, not only you. Okay. So till next video, bye.